Namaste. Let us learn about diarrhea. When there is thin, watery, loose stools are being passed, then there is diarrhea. And if it is more than 3-4 times in a day, definitely that person is suffering from diarrhea. Then the cause may be due to gastroenteritis. That means there will be intestinal infection or food poisoning. Either of the two may be there, or there may be some other reason. There may be an underlying cause like stress, strain, or food intolerance. Any of these things could be there. Even stress, strain also can cause diarrhea. When virus gets into the gut, that means it is a viral infection. If it is a viral infection, then just like common cold, whenever there is common cold, it is said if you take medicines, it will go within a week. Otherwise, it will take 7 days. That means you don't have to worry at all. It is a viral infection. It will go by itself. There is no need to worry at all. But for 3-4 days, if nothing happens, in the sense if there is no high fever, not much of a pain, or stomach pain is not very severe, and most importantly, if you are not passing blood and mucus in the stool, then there is no need to worry at all. What is required is rehydration has to be done. One has to look for the signs of dehydration. What are the signs of dehydration? If the amount of urine is less, if it is dark urine, if there is increase in heart rate, or headache, or dry skin, or confusion, these are some of the signs of dehydration. Then the first thing that should be done is we have to use electrolyte replenishers like electral, that is there. There are so many other. Otherwise, the government itself gives ORS, oral rehydration salts. These can be dissolved in water and can be used. So the first stress is on avoiding dehydration. That is the major cause of death in this particular type of disease. Then otherwise, what can be done is the stool can be sent for examination. If that has to happen only when the stools are dark, or if there is mucus or blood in the stool. Otherwise, it will go by itself. Just we have to take care of the rehydration, because whatever electrolytes that are going and the water that is lost has to be replenished. That has to be done. Or otherwise, if there is any itching in rectal area and all that, some cream can be applied or petroleum jelly can be applied. Otherwise, without going to doctor, whatever I am telling is without going to doctor. If there is no fever, then if it can be managed, then otherwise what could be done is we can take what are called as prebiotics. The food, fruits and vegetables that we consume, they act as food for good bacteria. Or probiotics can be used. What are probiotics? These are live yeast and good bacteria, so it will replenish the bacteria that are lost. Or otherwise, after the stool examination, if there is a problem, then the usual treatment is based on what type of infection it is. Otherwise, what is usually given is bismuth subsalicylate. We know salicylic acid. Salicylic acid is benzene ring, and at adjacent positions OH and COH is salicylic acid. Between these two groups, bismuth will be there. So this is bismuth subsalicylate. It is not just like other salt. So it is not sodium salicylate or something like that. So it is bismuth salicylate, which is present in a ring structure. Now, what are the activities, or how bismuth subsalicylate acts is bismuth has it has got bactericidal activity. It inhibits the growth of Helicobacter pylori, then enteric bacteria as well as fungi. It also has got anti-inflammatory activity, bactericidal, and it also is used as antacid. Even antacids are available which contain bismuth. And when bismuth is being used, it gives rise to black tongue and black stools. That is because of the formation of bismuth sulfide, and it is harmless and it is temporary and there is no need to worry about it. But bismuth compound should not be given for children and nursing mothers, because if it gets into the system, into systemic absorption, and if it gets in, it is neurotoxic. So it causes encephalitis, and it also causes constipation. So it should be used with care. Otherwise, if there is no blood in the stool, or dark stool is not being passed, and if there is no mucus, Loperamide can be given. Loperamide is given. It is actually a morphine analog. It doesn't have the structure of morphine, but it is not habit forming. It doesn't cross the blood-brain barrier. That means it acts locally. What it does is it reduces the intestinal movement. The tone of the muscles of the wall of intestine is reduced so that the faster movement of the intestine doesn't take place, and the material stays in the intestine itself, allowing more absorption of water from the fecal matter. So that is how it can prevent dehydration. So it can be used. Loperamide can be used. Otherwise, what could be done is what is called as brat, banana, rice, apple sauce, and toast can be given. This is usually mentioned as to what food, because ultimately you have to know what food you have to take if there is no infection and how to manage. The first thing is electrolyte replenishment using ORS, or you can take salt water and some amount of sugar in it directly in boiled and cooled water. Or this banana, why banana is mentioned is banana contains potassium, so the potassium loss that happens can also be reduced or compensated by using brat, banana, rice, applesauce, and toast. This is the information regarding diarrhea. Namaste.